It is now my honor again to introduce another one of our incredible panelists, Dr. Mirian Ofonedu. Dr. Ofonedu is a director of training at Maryland Center for Developmental Disabilities, Kennedy Krieger Institute. Dr. Ofonedu is a distinguished researcher, clinician, and professor. Dr. Ofonedu served as the project director of an NIH-funded clinical trial on early parenting intervention comparison research study at the Center for Child and Family Traumatic Stress at Kennedy Krieger Institute, and is the founder and clinical director of the Family Counseling Center. She currently holds faculty positions at Johns Hopkins University and the University of Maryland. She has published several peer-reviewed journal articles and serves on several boards and committees related to psychology, social work, and supporting children with disabilities. Dr. Ofonedu, we are so honored and humbled to have you join us today, and we are really looking forward to all the insights that you will share with us. So I will now pass it along to you, Dr. Ofonedu.
Thank you so much, Patrick. It is really great to be here today and to be a part of this beautiful community that is gathered here today. We all know that community is what makes us stronger, and thank you, Dr. Silos, for such wonderful tips that you've provided to us, including the yoga poses. When we feel included, our life and the lives of those around us does flourish. I was asked to talk about supporting mental health, particularly social inclusion of children with developmental disabilities. And I think building off of what my colleagues have shared, I'm going to take a different angle now with this. It's really a good reminder for all of us to really understand the needs of each individual, especially the needs of our children with developmental disabilities. So, dear friends, I really call on you right now to take a quick imagination activity journey with me. You can close your eyes if you want, or just kind of, if you're comfortable doing so. If not, just relax and just follow along. But I want you to imagine that you just woke up and you found yourself in another world, all by yourself. No single soul is present. You look everywhere and you could not find anyone, just you. How would you feel? How long do you think you will last before you start losing your mind? I welcome you to use the chat box to post how you will feel. And how long do you think you would last before you start going, I don't know where I am and what I'm doing? I'm sure many of you have seen the movie Castaway by Tom Hanks, a man who was stranded on a deserted island. And he lasted for 4 years, only finding comfort in an ordinary volleyball. So as you post how you feel, if somebody said 1 week, frightened, not sure, alone, scared, confused, so keep posting that. So just a lot of negative feelings, and this feeling of, I wanna get out, I wanna be with someone. So as we talk about social inclusion, what we need to understand is that we humans are interactional beings. We hate to be alone, as evidence to what you are all posting in the chat box now. This is why it's very important for us to really make the mental health and social inclusion of children and youth with disability a priority. As we all know, social inclusion does matter. There's no two ways about it. It serves as a protective factor for our children with disability. It is an important avenue for them to achieve psychological well-being. It also does promote mental health and a person's dignity. All of us, we need a sense of belongingness, right? These are all human needs, basic human rights that we are called to make sure that every single one of us is able to deliver. Social inclusion also allows us to celebrate neurodiversity. When we celebrate our differences and our abilities, we feel good. It is our differences and our uniqueness that binds us together as humans. So in everything that we do, including where we find ourselves now, we need to keep this in mind, that everyone comes with a different strength. Everyone brings different gifts and different abilities to the table. Social inclusion is what allows us to connect together and sustain our humanity. It is only when we learn to celebrate what each of us bring, that's when we can have a world that is much better. That's when we can truly celebrate diversity. Only when we also feel the power of social inclusion, that's when we can be able to recognize that social exclusion has no power or space in where we are. Now, as we think about the pandemic and we think about our individuals and children, especially with disabilities, we know that this pandemic has truly brought about more loneliness, more social isolation, a sense of fear and anxiety for all of us. This physical distancing and quarantine measures that we have currently in place is triggering a lot of behavior problems, right? And it's adding to the impact on mental health for our children. Many of them are now struggling in public spaces, if they are able to get to public spaces. These health measures in place, including the use of PPE, our kids are needing extra support to learn how to use those. They're also struggling with changes in routine. And as we know, most of our kids really don't like disruption in their daily activities. The opportunity for them to continue to learn and develop these important social and behavioral skills has been limited. Some of them are even experiencing regression to old and unwanted behaviors. Our parents are reporting that they are not able to fully return. This idea of not being able to really maintain a regular family activity is very disruptive to their health and to their family routine, especially with caring for a child with disability. We know that I was asked to give strategies, and again, every single person is unique and brings something different to the table. But I want to give you 4 C's. I know, Dr. Silos, you offer 3, and I have 4 that I need to offer. So I will call on you to think about 4 C's to effective advocacy. They include confidence, competency, connection, and collaboration. And for the sake of time, I am going to organize all 4 into 3 themes: self-awareness, building resilience, as well as building collaborative support systems. So the first one to inclusive practice is really self-awareness, because through self-reflection, parents, educators, providers, all of us can begin to really help to tap into our own inner core, which helps us build this confidence. It is important to always check in with ourselves, right? To examine the biases we are carrying and our attitude, especially when it comes to inclusive practice, especially working with our families and children with disabilities. We need to recognize our own individual identity. And what I mean by identity is that the relationship your identity has, the power and the oppression, and you want to use this power that it comes with to begin to help you get an understanding that will help you foster equity and respect for our children and youths, especially those from underrepresented communities. We must always challenge ourselves to engage in difficult and honest conversation about our individual differences. That is the self-awareness that I want you to call to always remember. The next one is building resilience. You and I will agree that every child with or without disability has strengths, right? And they bring unique talents to the table. I encourage you to draw from your competency. That's the second C. Your human capital, which are your skills and your knowledge that you have as a parent and as an educator to help you now begin to build on our students and our children's strengths. I call on you to teach a model self-regulation, and you've heard a lot of examples about how to go about doing that, and also effective coping for our children. They learn by watching us. They are copycats. So we need to really watch our behaviors and the choices we are making around them, especially during these difficult times. I call on you to try to maintain structure by having scheduled learning times is very important, and also to maintain routine by finding new ways to begin to do all things. It is important to also provide our children with activities that are oriented to their strengths and to their abilities. Those that are person-centered and that respect their unique differences. When we engage and provide our children with opportunities for meaningful social educational participation, everyone wins. So I encourage you to always practice including self-care so that you can be fully present. Taking this deep breathing, not only teaching a child, but also teaching yourself as well to do so. When you are able to really be fully present, you are better able to support our children. My office recently put together a resource guide on caring for yourself while you're caring for others. And I think I shared a link with Ms. Norris, who is going to post that link for you in the chat box. We must, all of us, dismantle this belief that only professionals or people with formal training can better interact with or assist our children with disabilities. Parents, I encourage you to come together as well. So I will call on you to really, this last point I'm going to offer you is on building collaborative support system. I encourage you to draw from your social capital this time around to make connection. So I talked about the human capital, which is your skills, what you have. Now your social capital is who you know, the connections that you make. But this connection needs to be meaningful connection. And we know connections that are meaningful are built on meaningful relationships. So I call on you to please build on and maintain systems of strong support for our children. Parents, I encourage you to keep the line of communication between your children's school, your job, the family, keep those open so that you can work collaboratively with others as you advocate for your children. Now, our educators and providers, I call on you to please remember that it's very important to establish a collaborative and sustaining relationship with our parents. They are now serving as learning coaches at home. They are the ones who are barrier nurses to prevent inpatient admission. They have a lot on their shoulder at this point. So it is important to meet them where they are and also to initiate the contact to meet with them regularly because you need their input and support. It's also critical to ensure that parents, you have the space to help our parents learn to be able to have some kind of workable level of IT literacy, given the telemedicine that we are providing now and academics learning online for the student. It is also important for you to collaborate with other social institutions and disability organizations. This will definitely ensure that coordinated actions and provision of equity-based services for our children are in place. We know that individual, family, and structural level social exclusions are harmful, right? So let us stop working in silos. I call on you all. Let us channel our efforts together because we are only stronger together. Let us advocate for safe shared spaces and opportunities that will empower our children with disabilities and to promote their health, mental health, and wellness. We know that inclusion matters because our children are too small to be failed. Thank you.
Wonderful. Thank you so much, Dr. Ofonedu. Thank you. And we have in the resource page that we're providing at the end of this, there's a wonderful article that Dr. Ofonedu wrote on social inclusion that she's given us permission to share. So that's going to be a great guide as well.